In this video, we're going to talk about mental health and adjusting to your injury. Mental health is a topic that's commonly overlooked, but it's just as important to take care of your mental health as it is to take care of your physical health. At least half of the people who acquire a spinal cord injury will experience either depression, anxiety, or post-traumatic stress disorder at some point after their injury. That's why it's important that we cover this topic, since a large portion of people who have a spinal cord injury will experience this at some point. The learning objectives are listed above. We'll spend some time identifying and understanding the emotions you might be experiencing. We'll educate you on signs of depression and different coping strategies you can use to help, and also how and where you can get help. You may have feelings of shock, denial, anger, grief, or sadness after your injury. That's completely understandable and natural. You had something major happen in your life, and you'll have to adjust and make a lot of changes to your typical routines. One way to help cope with these feelings is to understand them and be able to identify what you're feeling. Grief can be a result of any loss or major change in your life. If you're experiencing grief, then you might have feelings of shock, denial, anger, guilt, loneliness, and acceptance. Being in shock and denial might feel like you are numb, like what happened wasn't actually real life. You might feel anger about the situation you were in that led to your injury. You might place guilt on yourself or blame yourself for something you did or didn't do that was related to the cause of your injury. Being in the hospital and not having control of your life situation might make you feel lonely, away from everything that's familiar to you. You know you've reached a stage of acceptance when you're looking forward to the future and the road ahead of you. This all will happen on your own time. There is no standard amount of time that these emotions or feelings will last. Adjusting takes time, and with various challenges and successes, your emotions might be going back up and back down. It's important to be patient with yourself throughout the whole process and seek help when you need it. When emotions of sadness, anger, and grief last longer, they may change into depression. Depression is a common emotional reaction to having a spinal cord injury, but it can hamper your recovery and rehabilitation. When a person is depressed, they have several signs nearly every day that last at least 2 weeks. Some of these, however, may be as a result of your injury. Check if you or a loved one has had any of these signs for 2 weeks or more. Loss of interest and pleasure in activities that you used to enjoy, feeling sad, blue, empty, or down in the dumps, crying more than usual, feeling slowed down or restless and unable to sit still, feeling worthless or guilty, feeling pessimistic or hopeless, anxious or worried, changes in appetite with weight loss or weight gain, changes in sleep patterns, being unable to sleep or sleeping too much, problems concentrating, thinking, remembering, or making decisions, withdrawing from people or events that you normally enjoy, loss of energy or feeling tired all the time, or sexual problems. If you have any of these symptoms for more than 2 weeks, or you have had thoughts of suicide or trying to harm yourself, then please talk to your doctor. Here are some tips to help you cope. Move one day at a time and do your best to get through each day. If that day all you have is 30% and you give 30%, then you really gave 100%. Celebrate your wins, no matter how big or how small. Be kind to yourself. Get plenty of rest, exercise, and eat a balanced diet. The better we take care of our physical body, then hopefully our mind will follow. Set goals for yourself. It's easier to move forward when we're moving and working towards something, but also keep in mind and remember that goals can be changed. Write in a journal or take audio recordings of your thoughts. This can help you process your emotions and track your progress. Use leisure activities to help find pleasure and enjoyment in daily activities. You can always work with an occupational therapist to help engage in things that are meaningful to you. Connect with others who have been through it, through different support groups online or in person. Having a sort of peer mentor can go a long way. Being active can help to boost hormones and lower stress and create a sense of well-being, so try to be as active as you can. Also know that there are several different resources and people that you can turn to if you need help. You can get help while you're in the hospital, and you can talk to your healthcare team. You can speak with your primary care doctor or social worker once you're out of the hospital. You can speak with counselors. If you are religious, you can speak to members of churches, temples, mosques, or any other places of worship. There are also several mental health services and organizations. And keep in mind the people closest to you, your family and friends who are there and willing to support you. In a mental health emergency, you should always call emergency services. You can do this by either calling 911 or the Mental Health Emergency Crisis Line. If you have any follow-up questions about understanding your emotions and mental health following your spinal cord injury, or places that you can seek help and get resources, then please connect with your healthcare team and we can help connect you to the right people.